We are talking universal health coverage, and here in the meeting in Salalah, in the Sultanate of Oman, we have concentrated a lot of non-communicable diseases. However, our countries are in different states. There are some that are very advanced, there are some that are a little bit still striving to get there. And so we have with us the Director of Communicable Disease Department, Division, the Director of the Division of Communicable Diseases, Dr. Rana Hajjeh. Welcome to our program.
Thank you very much.
It has a long withstanding history that United Nations agencies have always sought to combat communicable diseases. They were pervasive, they were scary, and still are. However, there is a general shift in the world now towards more curative, more non-communicable diseases, more chronic diseases. Where do you think our region stands?
Yes, thank you very much, Ibrahim. I think communicable diseases in our region remain really important. Of course, with the development, non-communicable diseases are starting to have a more important role in terms of their burden on public health. So the epidemiology
and people
of
are living
diseases,
longer too.
People are living longer, they have better health care, we live in better environments, more or less. So the risk factors for non-communicable diseases are there. And as a result, non-communicable diseases are really emerging as very important causes of morbidity and mortality. Nonetheless, communicable diseases, which we should have actually
managed to
eradicate most of them, or to manage most of them, are still very strong in our region in particular. They have a very important role in terms of the numbers of death and illness that they cause. And unfortunately, in our region, especially recently in view of the emergencies and the conflicts that our region is going through, these conflicts have really weakened the health systems and infrastructure, which in addition to the migration of people, in addition to many other factors, and this has resulted in actually re-emergence of many infectious diseases. Some of them we have not seen for ages. We are now seeing outbreaks in our region of cholera, of diphtheria that we haven't even seen.
Cholera and diphtheria back again.
For like 50 years, even the doctors in the region, many
has
of
the
them,
immunization for DPT dropped, for example?
Exactly. So immunization is always, which has always been one of the strongest public health systems in our region, has suffered a lot because immunization coverage has decreased.
In the emergency states?
In emergency states, and also in some of the other states that are stable. Now there is an emerging some
lack of interest,
resistance or reluctance to hesitate, which is something, hesitancy, what we call hesitancy. We have seen always typically in the West in countries that are more developed. But the main factor is really the difficulty accessing people sometimes,
yes,
and children to immunize in hard to reach areas and areas that are experiencing conflict. So this, in addition to the breakdown in the water and hygiene infrastructures, in addition to the destruction of many health facilities, so all of this has really led to the emergency of re-emergence of many communicable diseases. So we don't want to be always alarmists and ringing, sounding the alarm bells, but communicable diseases are really important. There are, as part of the Sustainable Development Goals, we have many targets that are very specific to communicable diseases, especially for diseases like tuberculosis, malaria, vaccine preventable diseases. And now, unfortunately, even though we had made initially quite a bit of progress, now we are at risk of not meeting our SDGs because of all the delays that happened.
So it's not a question of either or.
Yes.
The ministers of health are really responsible for
everything.
Both, for everything.
Exactly.
And
yeah.
we need to think of prevention, we need to think of promotion, we need to think of communicable diseases, we need to think of non-communicable diseases. It's a big package and we're putting a big burden on them, but especially in the circumstances which you mentioned, Dr. Hajjeh,
sure,
the area. So we hope that
yes,
we will be able to reach this goal of universal health coverage, that everybody would be able to lead a healthy life.
We really hope so. I think universal health coverage right now is really the solution for us, because integrating the services, what they're calling now the packages for communicable diseases and managing infectious disease in general in primary health care and in all levels of health care is really the solution now to control, prevent communicable diseases, and to also reach the goals. So we need to also focus on the fact that many communicable diseases are preventable, are completely preventable. Yes. And our knowledge of infectious disease is really much older. We know which interventions work, what is effective for prevention, for treatment. So it's all there. We just need to implement and to not forget that the agenda of communicable diseases is not finished yet, and we need to finish it while continuing to focus on many other health priorities.
Because a lot of the non-communicable are also preventable, like healthy lifestyle and just do some exercise. And I leave you with that. That's all. Walk back a long distance rather than drive. Thank you.
Exactly. Yes. Thank you very much.